Doctor is in the house, and today I'm here with Dr. Alexander at South Texas Brain and Spine right here off of 3rd Street. Now, we've done a fantastic series with these doctors learning about all kinds of issues that either we ourselves or someone we love has probably dealt with or will deal with in our lifetime. So what I love about this is we're able to dive into some topics that we might be kind of familiar with, but learn a little bit more about what to expect in the event that we encounter these on our own. So first, let's list off a few of the spinal issues that we've covered thus far.
So we've covered both, I think, neck and low back pain issues, radiculopathy, sciatica, all those type of surgeries. You can approach the spine from all different directions, from the front, from the side, from the back. So the different ways we can approach it. We try to approach where the problem's coming from. The disc is usually anterior to the spinal cord. Sometimes you have bone spurs posterior to the spinal cord. So it's not just a simple one approach for it. So this is an example of a spinal fusion. So if you have back pain and sciatica radiculopathy, typically you have to stabilize one or two segments of the spine, or whatever the pathology is that cause it to, if you know, typically back pain is causing from excessive motion. Sometimes the facets are rubbing too much. Those are pain originating factors. So you have to stabilize that segment. So here's an example of a L4, L5 fusion. Now these look really big, but these are actually life-size screws, life-size rods. So basically you make an incision over the area that we're working on. Either you can go from the side or you can go directly from the front. We retract the muscles. What hurts in back pain and back surgery is the muscle retraction. The muscle is healing. Then we drop in our screws. Now when we put our screws in, there's a couple ways to make this as safe as possible. So not only are we directly visualizing the nerve in the spinal cord, we're also stimulating the probe that goes into the bone. And then we actually have an awl. It's like when wood cutting, this is more fancy carpentry. We put the awl under monitoring, so it's attached to an electrode, and we have an off-site neurologist who's actually monitoring what we're doing. So we want to, if there's nerve irritation or we have decreasing signals, then we can adjust either the screw, adjust what we did to see if we can recover. So like we do neck surgery from the front, sometimes you can see a depression on intraoperative monitoring. We can do both sensory and motor functions. Is a graft too big? It'll be causing too much distraction. And we can put a smaller graft in. We can go look for a blood clot, epidural hematoma, or something that would be causing problems or pressure on the spinal cord, and reverse that. Typically, most of the lumbar surgeries are now considered outpatient, but it could be in the hospital 2 to 3 days. It takes a couple of weeks to recover. It all depends what you. Not one surgery is the same for everybody. So it depends on how the patient is when they come in, how active they are, how motivated it is. So actually, a lot of it's up to the patient to get better. They have to kind of push themselves, do the right things, do physical therapy.
Following the doctor's orders.
Realistic on their expectations. If you have unrealistic expectations, you won't be happy and the patient won't be happy. So we want to make sure they're also putting their 100% effort into the healing process also.
Very good. Okay, well, thank you for giving us that reassurance. Again, these procedures can be really intimidating, but knowing that there's even more technology so that these doctors can know more about what they're doing and prevent future issues is really helpful as well. So if you're interested or if you need help, find our friends here at South Texas Brain and Spine. The doctor's in the house. Let them know that Coastal Living sent you. Thank you.
Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.